Good evening, everyone.
Hi, good evening.
Good evening.
All right, well, we're gathered here for the purpose of creating a public service announcement. It is an initiative uh, pulled together and initiated by the Haitian-American Nurses Association. Dorothy Crisostomo is here as the representative of that organization, the one accountable for having pulled together a number of organizations to collaborate on this public service announcement. Dorothy?
Good evening, everyone. I'm Dr. Crisostomo. I am the president of HANA, Haitian-American Nurses Association of America. And I received a call from Marie Cassand on Saturday, and she was a little bit concerned, and also she wanted us to be able to make an impact in our community because of some of the things that she was noticing across her Facebook page. And so she said, how can we get together to help the community understand that although COVID-19 is showing some slow patterns in some of the areas, but especially in Georgia where we are living, the numbers have definitely been increasing. And so as the president of the Haitian American Nurses Association, I found it necessary for us to take that challenge and invite some of the leaders in the community. So we decided that we would invite the Chamber of Commerce, the Consulate General of Haiti in Atlanta, and some of the restaurants that are popular in our areas. And so therefore, that's the reason for us meeting here tonight. And I'd like for the rest of you to introduce yourselves before we move into the statistics and into the purpose of the meeting for tonight.
All right, I'll take a turn and go first. My name is Sorel Ketan. I am the president of the Georgia Haitian American Chamber of Commerce, and I am here to support the public service announcement regarding COVID-19 because of not only my personal, but the Georgia Haitian American Chamber of Commerce's commitment to our community being safe and our community playing an important role in minimizing the spread of COVID-19 and our people staying safe and healthy. Thank you, Dorothy.
I'll go next. Hello, everyone. My name is Liz Tassi. I'm the Public Relations Officer for International Women of Hope and HANA Nurses Association. I'm also joining to shed some light in the importance of the risk that we're taking when everybody is out because of the businesses that's starting to reopen. So I'm here to let everybody know that quarantine and all the precautions necessary still need to be in effect in order to protect yourself and your community.
Good evening, everyone. My name is Marie Casson, and I am the co-founder of International Women of Hope. I'm also the vice president of UMS Investment Club. I am a long-standing member of the community, and I am here tonight to make sure that the community sees us as one, that we all have a common goal, a common purpose, and that's to keep our community thriving and healthy. So I look forward to the conversation tonight and to make sure that everyone sees that we have our community's best interests at heart. We want everything we don't want the casualties. We don't want the high numbers of deaths and sickness. And this is our purpose for being here tonight. Thank you.
Okay, so let's talk about some of the statistics around the globe and some of the statistics that relate to us in Georgia specifically. So this information is being taken directly from the CDC, Centers for Disease Control and Prevention. And the statistic was pulled today. So as of June the 22nd, there are more than 8,860,331 deaths, confirmed cases, and over 465,740 deaths related to COVID-19 in 216 countries. In the United States alone, there are 2,248,025 total cases, and about 32,411 of them are newly reported. And with 119,615 total deaths in the US, and 560 of the deaths are also newly reported. In the state of Georgia, where we live right now, it's recorded that 65,928 cases of COVID-19 with 2,648 deaths. They also reported 9,953 hospitalizations, and 2,155 of them are in the ICU, or intensive care unit. So this is the alarming facts that made us even more concerned to want to share with the public that COVID-19 is increasing and deaths are rising. And it's not just only in the state of Georgia, it's worldwide. And so therefore, we thought it would be very necessary for us to let the public know that there are a lot of precautions that need to be taken. There are no cures for COVID-19, but without precautions and taking certain preventative measures, there will be lots of deaths. And so the purpose for this is to encourage you to take the necessary precautions that some of our colleagues will be sharing with you, so that we keep safe for ourselves, for our families, for our friends, for our neighbors, and to make sure that we survive this and not become a victim of COVID-19.
Thank you, Dorothy. Thank you. And in terms of precautions, what do you want to say to our community regarding the precautions we need to take?
I'll take that question. In terms of precautions, this is not a new thing. This is, everybody have already known what precautions, but I want to reiterate so you know how important it is to take these precautions. First and foremost is hand washing. Hand washing with soap and water for at least 20 seconds. And if you are somewhere that you are not able to have water, soap and water, hand sanitizer is also good. It's a good alternative as long as it's a good 60% alcohol contained. Also, of course, avoid touching surfaces. And if you do, wash your hands. When you out, make sure you wear a mask of something to, whether it's, I happen to have one right here, whether it's these disposable ones or the cloth ones. Make sure you wear a mask so to protect yourself and protect people around you. And also practice the 6 feet distance between you and someone else. I know there's a lot of businesses that are opening right now, and they do take precautions and put marks on the floor for people to have an idea where to stand between yourself and someone else. So please observe these indicators so you can protect yourself and protect your environment. And also, especially stores, grocery stores, they have a one-way rule where you cannot come across back and forth. Just follow that rule because there are arrows on the floor for you to follow. If you follow these steps, you will most likely be at less risk. And go out only if it's absolutely necessary. I know restaurants are open. I know we all having cabin fever. We've been at home for at least 3 months, and we all want to be out there. You can go out. You can go out for a walk, for a run, because it's healthy. You need to do that. But avoid gatherings, especially large gatherings. Avoid touching surfaces and touching your face, touching your mouth, your eyes, your nose, and sometimes you don't even realize it. And they saying there was a study that said that people touch their face about 20 times in an hour. So without even thinking. So just think about that. So anytime you have the opportunity to wash your hands, because you are going to touch your face, whether you are aware of it or not. So the most important thing is to wash your hands for at least 20 seconds. And also, of course, like Dr. Dorothy said, there is no cure so far for COVID-19. So what we need to do is preventive measures and also get your immune system boosted up in shape. Make sure you exercise, drink a lot of water, especially warm water, because this virus is a type of protein that's coated with a layer of fat. That's its structure. So therefore, if you catch the virus, if it's in your mouth, in your throat, and you practice drinking warm water, especially tea or with lemon in it, it flushes it down to your stomach, where it meets with gastric acid. Well, this is the nurse talking. It reaches gastric acid in your stomach that will destroy the virus. So that's why it's important to drink warm water, tea, coffee, and of course, good tea like ginger, cinnamon. Anybody you can throw in suggestions, but these teas are very good. And also, it's very important to add zinc to your diet, because that boosts your immune system, which in turn will be able to be strong enough to fight the virus should you catch it.
Thank you so much, Liz. Thank you. And I know people listening may also be thinking, oh my God, it's been 3 months. And it's tough to be, quote unquote, slowing down or closing your business for 3 months. That can take a toll on your business. We do understand that. So we're not saying do not open. We're simply saying every single measure that the state or the federal government has put in place to help keep us healthy, to help keep each other healthy, it makes good business sense for your business to actually take those measures. It actually makes you more competitive. You could be the one marketing and advertising saying, just like Pizza Hut says contactless delivery, you could be saying contactless delivery. You could be saying contactless dancing. You could be saying contactless eating. You could be saying contactless anything. Seize this opportunity as a business to create yourself as the one that meets 100% of the measures and adheres to everything that demonstrates to the world that who you are as an establishment is someone that's not only concerned for the safety of others, but you have demonstrably taken all of the measures necessary to give the public, the state, and everyone involved the confidence that you have done everything you need to do to keep them safe. And maybe, just maybe, that might create a flood of business to your place because people are concerned. And the more you do to alleviate these concerns, the better your business will be and the healthier we'll be as a community. Dr. Dorothy, What else do they need to know and hear?
Well, in speaking with Marie Cassandre yesterday, it really brought to our attention that people are really not taking this COVID-19 as seriously as they should. So again, I'm going to share another statistical data so that we understand the gravity of this COVID-19. And this reference is taken from the World Health Organization 2019. It states that there are 43.5 million nurses in the world. And there are about 90,000 of them that have been infected with the COVID-19. And given that number, we don't want to see the people that are able to help us stay healthy get sick and die. And at the same time, yes, it's necessary, and it's necessary for businesses to stay open or to open because economically it is devastating. But life, I believe, is more important at this point than reopening in the wrong fashion. Yes, there are a lot of businesses that are opened, and they take the precautions to avoid having catastrophes, to avoid having the staff become infected. They take precautions to make sure that the people that are coming into their establishments, either they wear masks or that they check their temperature. And if they notice that they look sick, they may ask them to leave. And so these things are some of the things that we need to be thinking about as a business owner, but also as citizens. We have to be conscientious about some of the decisions that we make, because everybody we meet and everywhere we go, we leave something. Let's not leave COVID-19 wherever we go, because COVID-19 is not a virus that everyone shows symptoms for. So if you're not showing symptoms, you don't know if you have it, if you don't have it. And those that are not showing symptoms are more likely to infect other people. And so that's the reason we ask, wear a mask or wear a face covering if you are coming in contact with people that you do not know, or with people that do not stay in your home. Even if it's a friend, even if it's a close friend, if you're coming into contact with that person, if they're not living in your household, wear a mask, wear gloves, so that we minimize the spread and we reduce in the areas where it is already, that we do not make it worse.
You're absolutely right. For us to recover from COVID-19, we actually have to be around. And what you're pointing to are the measures that we each individually and collectively must take so we can be around to recover economically, socially, and personally. So, Dr. Dorothy Crisostomo, thank you for pulling this together. Marie Cassandre, the matriarch of our community, thank you for pulling this together. Lise Dassey, the head nurse, thank you for the valuable information provided, and thank you for being part of this initiative to not only alert our community, but to encourage them to do what's right by us and by them. Dr. Dorothy, anything else we need to say?
I want to thank you, Mr. Ketan, for giving us the opportunity to come together and to show the community that when we speak about their safety, we speak in one voice. And when we speak about their well-being, we speak in one voice. And so this is coming not only from the Haitian-American Nurses Association, it's coming from the International Women of Hope, it's coming from the Consulate General of Haiti, it's coming from the Chamber of Commerce, Georgia Haitian-American Chamber of Commerce, and it's coming from the others who may not have had the opportunity to come on this show. And we appreciate everyone that takes a personal responsibility to make sure that we are safe. And I thank you for letting us use your platform to be able to provide this information.
Let's also send a great big thank you to our friend Shanae Neret of Haiti On Demand. Shanae Neret will be broadcasting this to other communities where our brothers and sisters reside and live. So thank you to all who are involved. And on that note, we bid you good health, and we bid you strength and resolve in staying the course for doing what's safe and what's right by you and by the people around you. You're not wearing a mask to protect yourself. You are wearing it to protect all of us. So thank you for doing that. Dr. Dorothy Crisostomo, Marie-Cassandre Merisier, Lise Tassi, thank you so much. Until next time.
Thank you. Have a good night. Thank you.
Thank you. Have a good night.